back, everybody. It is time to talk about the hottest topics in medicine right now. And to do that, we are joined by Daytime's medical experts, and they are cardiologist Dr. Srinivas Iyengar. We've got Jen Landa, who specializes in preventative and regenerative medicine, and OBGYN, Dr. Jill Heckman. Good to have you all here.
Great to be here.
Thanks so much. All right, we're going to get right to this, and I'm going to start with a study from the Mayo Clinic that says vitamins don't reduce the risk of cardiovascular disease. A vitamin that might improve your heart health is vitamin D, but there's nothing conclusive yet. How do you all feel about vitamins?
Well, let's start with the study that just came out recently, the Journal of American Medical Association. It's basically the Physicians' Health Initiative. It's about 15,000 male physicians that were examined for the last 10, 11 years for taking a multivitamin once a day and seeing the outcomes of whether or not it increased, decreased, or did no effect on cardiovascular disease. And it found, interestingly enough, that these physicians that were taking this multivitamin versus the placebo, that they didn't really have any effect on cardiovascular disease. It didn't increase it, but it didn't decrease it. Now, the interesting thing is there's some subgroup analysis about this study that maybe the multivitamin helped with cancer risk or reducing cancer risk, but that's something that's still going to be, thought about. And I think, obviously it's a really controversial topic right now because everyone seems is taking a multivitamin of some sort. So, ladies, what do you guys think?
Dr. Landa, do you think the multivitamin is worth taking?
It's interesting, Cindy. My take on it is a little bit different. A multivitamin, maybe not. That's what the studies are showing us, and that's what studies, even earlier renditions of the same study have shown us as well. But with a multivitamin, they're trying to fit everything into one pill, kind of like a one-size-fits-all.
Sure. People need the convenience.
Exactly, exactly. But in other studies that have been done with higher doses of vitamins or different quality of vitamin, they've shown some positive outcomes. So because the multivitamin has not been seen to be negative, and it could be positive, but I think we need maybe a different formulation of these different vitamins to really be able to get the most benefit out of vitamins, because some of them do reduce free radical damage, which is one of the big things that causes cardiovascular disease.
What about vitamin D? Is that being proven to be beneficial?
Well, I'm sorry. No, go ahead. Well, like I said, vitamin D and vitamin E and antioxidants of a number of different formulations. Again, it's important. What's the formulation? What's the dosing? How much of it to take? Because studies will come out saying a positive effect of a certain vitamin on cardiovascular risk or other health risks.
Okay.
And the issue right now is we're still trying to figure out what is the exact dosing, and just like we just previously mentioned, what is the correct formulation of these vitamin supplements?
Right. It's a multi-billion-dollar industry, that's for sure. Okay, Jill.
I would just say, just remember that we always do recommend it's not going to do any harm.
Right.
Even if it doesn't show a direct benefit to cardiovascular health, it will not harm you. And always remember that it can never be a substitute to a healthy diet. I think we would all agree that the healthy diet is the most important.
That's what my parents always say. All right, number 2. In a recent Danish study, after 10 years of treatment, women receiving hormone replacement therapy early after menopause had a significantly reduced risk of mortality, heart failure, or heart attack without any apparent increase in risk of cancer or stroke. What are your thoughts, Dr. Jill, first of all, on hormone replacement therapy?
I think that it needs to be individualized per patient. And we were talking beforehand about the different views that all of us have on hormones and cardiovascular health. And there's different studies out there. And I don't think that we can make a blanket statement that would fit every patient that's out there. So you need to talk to your doctor.
Will you prescribe them?
I do on occasion, but I always start with the least invasive things first. So things like other medications, that side effects of those medications that help improve symptoms of menopause, as well as some over-the-counter treatments that could help.
Dr. Landa, I know you are a big proponent of hormone replacement therapy.
I am a big proponent of hormone replacement therapy. I personally look at some of the data that shows, like you said in this Danish study, and there's been other data that looks at cardiovascular disease, and estrogen in particular seems to be beneficial. And even going back to studies like the WHI, the big one, women who were 50 to 59 did show a good cardiovascular benefit. So like Jill said, Dr. Jill, I think it's very important to individualize. I think it's very important to know your patient, what they are, and prescribe specifically for that.
What about the risk of breast cancer, though? We've heard that.
The risk of breast cancer, of course, is something, it's another one of those individualizations.
Okay.
Depending on which hormones you use in which women, you may be able to show benefit and no risk, no increased risk.
I mean, the best way to say it from my perspective is that when I have a female patient that's in the office, that's in her 50s or she was an age where she's going through the effects of menopause.
The change.
Yeah. And let me tell you something. It's from a male's point of view. Clearly, we don't have the understanding. We don't have that. So we say there is something of a male menopause at this point thought of with the testosterone levels, but with a female, it's much more predominant. It's easy for to say, well, don't worry about it. You have heart risk with hormone replacement, but women who are having the symptoms, they really, really want some type of relief. And that's why
quality of life.
For sure.
Quality of life, exactly.
Okay, really quickly, energy drinks. Are they safe or dangerous? The FDA is considering caffeine limits on energy drinks after emergency room visits involving such products jumped tenfold from 2005 through 2009. Also, 5 deaths are being linked to energy drinks.
Well, clearly, right now, energy drinks are definitely in the hot button topic right now. It's all in the news. And the main reason is the FDA doesn't regulate the amount of caffeine that are in the ingredients right now. Guarana, which is a caffeine type of extract, or is a formulation of caffeine, is not regulated right now. And Monster, Red Bull, a number of these drinks can put pretty much an unlimited amount if they want it. And unfortunately, you have a lot of younger individuals drinking this, multiple beverages in a day. And if they have any predisposition for heart arrhythmias, these can obviously exacerbate it.
All right, so don't drink them.
Don't drink them.
That's all there is to it. Okay, doctors, I'm going to have you stick around, all right, because we've got more topics to talk about.